Breast lifts have become one of the most common plastic surgery procedures in the U.S., almost outpacing breast augmentation. I'm Dr. Tiffany McCormack, a board-certified plastic surgeon at Reno, Tahoe Plastic Surgery, a world's leading clinic. Today, I'm going to talk to you about what a breast lift is, who it's for, and what you can expect. A breast lift, or mastopexy, is a surgical procedure used to reshape and/or lift the breast. It can be done on its own, or implants can be included to add volume at the same time, to restore a more youthful look and place the breast higher on the chest and give a perkier or more balanced outcome. So who's a good candidate for a breast lift? First of all, you should be in good health. Your weight should be stable, and you should be a non-smoker. This is typically performed on patients who are experiencing ptosis, or sagging of the breast. So we look at nipple height, usually relative to the inframammary fold or the crease at the bottom of the breast. We also look at where the breast is sitting on the chest in general, and we look at the quality of the tissue and how much laxity there is. There are different degrees of ptosis of the breast, and ptosis is often measured by where the nipple is relative to the inframammary fold or the crease at the bottom of the breast. There can be grade 1, where the nipple is usually just above that crease, grade 2, where the nipple is typically at the crease, and grade 3, where the nipple is below the crease. All of those can be indications for needing a lift, and those can all contribute to a sagging or deflated looking breast that can be corrected with a mastopexy or breast lift. How long does breast lift surgery take? It usually takes 2 to 3 hours and is typically performed under general anesthesia as an outpatient procedure, which means you go home the same day. What does recovery and downtime look like after a breast lift? Typically, if you have a desk job, you can expect to take 3 to 7 days off work. If you have a more rigorous job, I would expect a couple of weeks off work. I don't want any heavy lifting or any strenuous activity, typically for 4 to 6 weeks. If you're a stay-at-home mom and you're worried about young children, make sure you have help in place to help you with the lifting and all of the day-to-day activities that are involved with small children, because this can be considered heavy lifting after a surgery. So what can you expect before, during, and after your procedure? Before your procedure, you can expect a full consultation to discuss what your goals are, whether or not you want volume added to the surgery or if you just want to lift, or if you want to lift and a reduction at the same time. All of these can be achieved with different types of surgery. So it's important to discuss what your goals are and get a comprehensive plan and discussion going with your plastic surgeon before the day of surgery. On the day of surgery, you can expect to talk to your plastic surgeon another time and expect them to do some markings on your chest and once again review what the goals are and what your plan is. Surgery itself is typically done under general anesthesia and can take 2 to 3 hours. You'll need a ride home from your surgery, and you can expect some mild to moderate discomfort for the first few days. If you experience mild to moderate discomfort, this is often well managed with pain medication. You can expect to be fairly tired after surgery during your recovery, and this soon resolves as well. I like to see my patients the day after surgery, and again, maybe at 1 week, 2 weeks, 6 weeks, and so on, up until 6 months to 1 year. And then if you have implants in place, we'll want to monitor you for longer than that. While the implants are there, we want to make sure that the integrity of the implant stays intact with ultrasound imaging in my office. How long can you expect your results to last? Some of this depends on genetic factors, aging, weight gain or loss, or future pregnancies, but for the most part, you can expect your results to last for several years. A breast lift can really help restore shape and confidence of the breast. In my practice, we see patients day 1, and often the surgical markings are still in place, showing where that breast was the day before, and it can be quite striking how different it looks the very next day. To learn more about breast lift, visit worldsleadingclinics.com.